Hello everyone, Dr. Mark Russo from Naples Nephrology here to discuss several issues with you regarding dialysis. If you're on dialysis, sometimes you get very, very sick. You're at home and you're ill. Sometimes that's related to you needing dialysis. So it's a good idea to come to the dialysis center, of course, unless you cannot and you really have to call the emergency medical services or 911 to get you to the hospital. But just know that many, many times you might be having certain feelings because you need dialysis. If you come directly to the hospital, you can actually delay your treatment because by the time we get the nurse in, by the time you get on the schedule, etc., it may take a little bit longer. So please keep that in mind. And sometimes it's just best to come right to the dialysis center if you're feeling tired or weak, because you're going to get a quick mini assessment by one of our nurses or technicians, or even one of the physicians maybe at the center. Please keep that in mind. Fluid gains. Please be really careful with fluid gains in between treatments. That's probably one of the most important things that we've got to be cautious about, because that's what could put you into more and more danger of having an episode of pulmonary edema or heart failure. So the less fluid you take in between treatments, the better things are for you. Remember, your kidneys were able or capable of getting you to your quote unquote dry weight. Now you've got to wait for dialysis for 48 or even 72 hours to get to that dry weight. So please, the less you take in, the better. We usually suggest a quart to a quart and a half. As you continue on dialysis, you will lose the ability for your kidneys to make urine. You'll be making less and less along the way, becoming more and more dependent on that filter. So the better understanding you have of that now, the better off it's going to be when you do lose that residual kidney function and you're incapable of making urine. You make it a lot easier on your heart by not taking in a significant amount of fluid in between treatments. The less fluid that you take on, the less your heart has to pump around or push around. The next thing is diet. We are always going to be stressing with you low phosphorus diet, low potassium diet, and excuse me, and high protein intake, and of course low sodium. The less salt you take in, the better things are. It'll be good for your blood pressure. Remember, fluid follows the salt molecule. So the more salt you take in, the more fluid you're going to retain, the harder it is for us to remove that from you while you're getting dialysis. Be careful with potassium-rich foods. Potatoes are high in potassium. You're looking at all citruses. Please be cautious with the intake. Those are the things that can get you in a moment's notice. You won't have a warning sign to that. High potassium causes or can cause a cardiac rhythm problem, and that's one of the reasons why we always instruct you, please be careful with taking in all of these extra potassium foods. The dietitian will be discussing that with you on a regular basis. Myself or one of our associates will be doing that, and even the nurses will be talking about that. High phosphorus foods, things like cheese, dairy, milks, please stay away from those. Dark soda, please try to not take in any dark soda. The only one that is probably safe is mug root beer. Many of you probably never even tasted root beer before, and I'm not advocating to take in soda because there are empty calories in there with the sugar. So maybe just regular water or one of those regular flavored waters are okay. But please run it by us first. If you have any questions, just bring it to our attention. General medical issues. If you go to your regular doctor, please, just because you're on dialysis doesn't mean you can avoid your other medical problems. Go in for your regular colonoscopies every 5 to 10 years, depending upon if you have any polyps or if you have a history of colon cancers or a family history of colon cancer in the past. Don't forget your GYN exams. Make sure you get those breast exams and mammograms, as well as the vaginal pap, as long as your doctor is suggesting those things. Skin. We live in Florida. There's a high degree of skin cancers. Go to the dermatologist every once in a while to make sure that we take care of those problems. Your cardiologist. Some of you do have cardiac problems. Have regular follow-ups with the cardiologist. If he or she notices that you have a drop or a reduction in how well the heart is pumping, you should always ask that. The same way we've told you prior to coming on dialysis, we used to say, hey, your kidney function is 20%, your kidney function is 30%. You need to ask your cardiologist, what's the function of my heart? The typical or average function of the heart is anywhere between 65 or so percent. And so you want to know, how well is that heart working? What is the percentage that it's working? Of course, the lower it is, the more concerned we get, and the more difficult it is for that heart to push around the fluid, and the more detailed or the more strenuous we become or stronger, discussions we're going to have to try to limit you not only with the fluids, but of course the sodium intake. And finally, one of the topics that I'd like to bring up is about your mental status, your social status. This is a significant change in your life. It's going to affect you mentally. You're not the same person that you were 10, 20, 30 years ago. We don't expect you to be. And we know it's going to wear on you mentally. You may develop depression. You may develop some anxiety. This is not a definite, but those things are possible. Don't be afraid to take it up with us. And if we have to get you the right help, we will get you that right help. But we're all here to listen to you and talk to you about that. Not only do we have to worry about things like depression and anxiety, but what happens is you become this. You may develop this withdrawn feeling, and that could feed into these other medical issues that we've talked about, and it can affect your ability to eat. Many times individuals that are on dialysis have a change in sleep habits. This is one of the more difficult things to treat when people are getting these treatments. We don't have a big answer for it yet. We don't like using the sleeping pills. They don't last very long. They don't work long. They sometimes, or we just, many times, we just see the side effect of the medication and no real benefit. But there are some tricks that we have that may be able to help you. And some of that it has to do with breaking the cycle of the monotony and having steady or stable blood pressures. And it comes along with improvement of exercise, getting away from the television, getting away from the computer. Very simple, common sense things could reestablish or help reestablish that sleep cycle. If there are any questions regarding anything that I've discussed today, you can reserve them for when myself or one of my associates come in rounds, and we look forward to seeing you in the future. I want you to have a healthy and happy life. Other than that, have a great day.